Welcome back, dear students. So today's topic we will discuss about preterm labor, and associated with preterm labor is a condition which is called preterm pre-labor rupture of membranes, or in short it's called PPROM. But I have also added some slides regarding pre-labor rupture of membranes, which is called PROM, only one P. Okay. So by the end of this lecture, you should be able to know what is the magnitude, what causes, and what can be the possible consequences of having a preterm labor. You should know the difference between a threatened preterm labor and an actual or established preterm labor. You should be able to know the potential complications which are associated with having a preterm pre-labor rupture of membranes and preterm delivery, and know the basic principles of management of an established preterm labor and when the membranes are ruptured prematurely. Okay, so how do we define preterm labor? Preterm labor, before defining preterm labor, we should, of course, know what is labor, right? So in a previous lecture, we said that labor is the onset of regular uterine contractions, which causes change in the cervix, like it causes cervical dilatation. That's the definition of labor. And this labor may start before the fetal membranes being ruptured, or sometimes the fetal membranes are not ruptured. Okay, so in the definition of labor, rupturing of fetal membranes, it's not included because it can happen before or after that. Now, how do we define preterm labor? The WHO, World Health Organization, says that if the labor starts before, like whether it is started by the doctor or it starts spontaneously before 37 completed weeks. Okay, you do not need to remember the 259 days, but it means that, so even if a patient delivers at 36 weeks, for example, 36 weeks and 3 days, so by definition, it's a preterm labor. Okay. Although when a baby is delivered closer to 37 weeks, of course, the better it is. Although when a baby is delivered closer to 37, okay, so by definition, even if a patient is delivered at 36 weeks and 6 days, although it is just one day short of having a term delivery, still by technically. So roughly 12% of all, and the statistics say that 15 million are born preterm every year, and a lot of these babies, they die, and 1.1 billion per year, 1.1 billion per. And unfortunately, most of the preterm deliveries, they happen in the developing countries, and so it's just kind of an extra burden to the. What causes preterm delivery? Of course, we will come, but so 50%, half of all preterm deliveries, they start on their own, which means it's a spontaneous, like women go into labor on their own. And there may be different reasons, which we are going to discuss, like women go into labor on their own, and there may be. Secondly, sometimes what happens is the fetal membranes, like the amnion and the chorion, they are ruptured, okay, due to different reasons. Again, we will discuss later. And then that leads to the start of having preterm labor and preterm. Okay, that's almost 1 in 4. So that means 1 out of 4 preterm deliveries, they happen as a result of having preterm pre-labor rupture of membranes, which is called PPROM. That means 1. And then 1 out of 4 preterm deliveries that happen because the healthcare worker, the doctors, they induce them. And this induction of labor preterm, it may be because of many different reasons, may be related to maternal health or may be related to fetal health. And so that means 2 out of 4 preterm deliveries that happen as a result of women. 1 out of 4, they happen because the membranes were ruptured, fetal membranes were ruptured, and 1 out of 4 because the doctor induced them, because the doctor had concerns about fetal or maternal health. 1 out of 4. Now, what are the risk factors? Which women are at risk of developing going into preterm delivery? Now, so there are some general associations. For example, women who belong to a lower socioeconomic status, they are more likely to go into preterm. And why that may happen, it may be related to severe malnutrition, or it may be related to some other associated problems. And why that may happen, it may be, for example, we know that Women having urinary tract infections, if they have recurrent or if they are not treated, they can go into, okay, so urinary tract infections in pregnancy, that's a recognized risk factor to go into preterm. Teenage mother, okay, so just having a teenage mother, because usually it is again related to the socioeconomic status, because usually teenage mothers, they are more likely not to have social support. Advanced maternal age, why is that so? Because especially after the age of 40, women are more likely to have other medical comorbidities, for example, hypertension or type 1 or type 2 diabetes mellitus, and which in turn can lead to maternal and fetal complications, and as a result that may lead to iatrogenic induction of preterm labor, and as a result that may lead to iatrogenic. First pregnancy, which is a primary gravida, then sometimes it can be a lot of environmental stress, like not routine. First pregnancy, which, okay, so but a lot, cigarette smoke. For example, in war-torn areas, yes, women are more likely to go into preterm labor. Cigarette smoking, either active or passive, severe malnutrition, alcohol abuse or other drug abuse, especially cocaine, and especially if the women belong, it's okay, again it comes to the socioeconomic status. So now etiology, okay, now we will talk about the medical conditions which can cause preterm labor. Now, first is, of course, PPROM. If the fetal membranes are ruptured, the uterus may feel irritated and it can go into labor, especially if there is infection inside the uterus. If okay, so PPROM in itself, it's a risk. Then sometimes the neck of the uterus, which is called the cervix, so the cervix can be weak. Then sometimes the neck of the uterus, which is now the more the term which is more, previously it was more commonly called cervical incompetence, so that means the length of the cervix that is short. Okay, so remember at the neckal translucency scan on the ultrasound between 11 to 14 weeks, one of the things at the NT scan which we see is the cervical length. Okay, so right, so if cervical length at that stage is less than 2.5 centimeter, which equals 25 millimeter, women are more likely to go. Okay, so we will discuss later how can we prevent and how can we try to help these women who have cervical weakness and a short. And third is placental abruption. So placental abruption, because if there is collection of blood inside, right, the placenta starts to separate from the walls of the uterus before going into labor. And third is placental abruption. So what happens is it can irritate the uterus, and whatever irritates the uterus, it starts to contract. Okay, it can be an infection, it can be blood inside, any condition which irritates the uterus, or even if there is, say, for example, right, for example, if a woman is being operated upon for acute appendicitis, for example, and because appendix lies very right, so even if the problem is not inside the uterus, or even if there is a systemic illness, uterus does not, it just starts to contract. Okay, it's irritated. Then there may be uterine. What does that mean? Some women, they are born with abnormal shapes of the uterus. What does that mean? Some women, they are born, for example, some women may have unicornuate uteruses or even bicornuate. What happens in that case is the space for the baby to develop inside the uterus, that is less than what is required. What happens there? And as a result, women can go into preterm labor. And systemic disease, like if there is, for example, sepsis, and it can be because of any problem, like anything which is causing a systemic disease, right? For example, sepsis, even secondary to a urinary tract infection or pyelonephritis, or if there is cholecystitis, or just name anything which, or pneumonia, right? So anything, any systemic disease which is not treated well or which is not responding well to the medication, right? So anything, any systemic disease which. Then the next one is ascending genital infection. That means, so from the vagina, if there is infection ascending into the uterus, that condition is called chorioamnionitis. Okay, chorio is the name for the chorion, and amnion is the, like, so if there is infection and inflammation of chorion and amnion, that becomes chorioamnionitis. Okay, and pelvic. Okay, so uterine distension. So if the uterus is over distended, for example, if there are twins or triplets or quadruplets and so on, the bigger is the number of babies, the more is the woman likely to go into preterm labor. Okay. Or if there is news, now this polyhydramnios means having a lot of water around the baby. That usually one of the most common causes is having diabetes. Now this polyhydramnios means having, right, especially uncontrolled, poorly controlled diabetes mellitus, but it can be because of a fetal anomaly, right, especially for example, if there is an open neural tube defect, there is associated polyhydramnios. Or if there is a bowel obstruction of the baby, for example, if there is duodenal atresia, there will be a lot of news, right? The baby is unable to swallow. Okay, but so what happens is there is a lot of polyhydramnios. Then, so especially if there is a direct trauma to the abdomen of the woman, that can lead to placental abruption, and she can go into preterm labor. So especially if there is a direct trauma to the abdomen of the woman, okay, and then sometimes we don't know actually. That's called idiopathic. Okay, so sometimes none of these conditions apply, but still. So sometimes none of. Now, why it is dangerous for the baby to be born premature? Okay, so the earlier the baby is born, the more severe and life-threatening these conditions can be. So I am just writing some of the, mentioning some of the complications which are more common. So first is the RDS, which is respiratory distress syndrome. Okay. Second one is ventricular. Okay, so second one is intraventricular hemorrhage, or so the ventricle of the brain, okay, not the heart. So intraventricular. Then third one is related to bowel of the baby, which is called necrotizing enterocolitis. Then kernicterus. So what is kernicterus? It's actually because all of the body systems in the baby, depending on at what stage the baby is born, they are immature. So what is kernicterus? It's actually because all of the body systems in the baby, depending on at what stage the baby. So liver may also be immature, right? And also there is something which is the blood-brain barrier. So in preterm babies, if the liver is unable to conjugate a lot of bilirubin, so babies have higher hemoglobin level compared to adults, right? We already know that. So and what is the breakdown product of hemoglobin? That's bilirubin. So that's where the bilirubin comes from. So and what is if the liver is unable to take care of this excessive bilirubin in a baby, then what happens? There will be, of course, there will be bilirubinemia, and if the blood-brain barrier, especially in premature babies, so this increased bilirubin can cross the blood-brain barrier in the babies and can be deposited in the brain of the baby, which can lead to fits, and it can be life-threatening. So this increased bilirubin can cross so that condition is called kernicterus. Okay. Then hypothermia. So why hypothermia? Because preterm babies, they do not have adequate deposits of adipose tissue. So as a result, they are unable to maintain their body temperature, and even in term babies. So you may have noted that as soon as babies are born, they are dried, they are cleaned, dried, and covered properly, right? They are dried, they are cleaned, and then they are given a cap that is just a means to protect them from hypothermia, because hypothermia is one of the preventable causes of, okay, sometimes, and especially in operation theaters where C-sections are being performed, or in labor rooms when the babies are being born, we have to make sure that babies are not directly under. Okay, so the temperature should be maintained. Otherwise, healthy babies, even term babies, can die of hypothermia. Okay, so the temperature should be. Then preterm babies are more likely to develop sepsis, and depending on how early they are born, they may have cerebral palsy. Okay, so that's the lifelong complication. It depends how early the babies are born, because sometimes you may even see some case reports that even baby who was born with 600 gram at birth, they were saved. It depends how early the baby, but later on, what happens is these babies are at a very high risk of developing cerebral. Now, what is the difference? So, established or actual preterm labor, what happens is it's the same. So, established or the uterus starts to contract and the cervix starts to dilate. That's an